Basal metabolic rate or BMR is the energy expenditure at rest, awake, required to maintain normal physiological functions, that is respiration, activity of the heart, metabolic activity, etc. Significance of basal metabolic rate, hormonal status. In hypothyroidism, there is increased basal metabolic rate, and in hypothyroidism, there is decrease in the basal metabolic rate. It is also used to calculate the calorie requirement and to calculate the SDA. Measurement can be done directly by the calorimeter and indirectly by oxygen consumption. Factors affecting basal metabolic rate. The first one is gender or sex. Basal metabolic rate of males is higher than females. The cause is because of low percentage of muscle mass, high percentage of adipose tissue, and difference in sex hormones. The second factor is age. Increase in age decreases the basal metabolic rate due to loss of muscle mass, that is lean body, and replacement of muscle with adipose tissue. The third factor is body size. Larger the surface area of body means more the basal metabolic rate. As larger the surface area, there is increase in heat loss and there is increase in heat production along with increase in the basal metabolic rate. The fourth factor is nutrition. Basal metabolic rate is low in starvation and undernourishment due to lean body as compared to a well-fed state. The fifth factor is body composition. Basal metabolic rate is expressed as per kg of lean body mass or fat-free mass, and adipose tissue is not metabolically active as lean body mass. Therefore, increase in adipose tissue decreases the basal metabolic rate. The sixth one is hormones. In hypothyroidism, there is increase in basal metabolic rate, and in hypothyroidism, there is decrease in basal metabolic rate. The seventh factor is environment. In colder environment or in colder climates, the basal metabolic rate is higher, and in case of tropical areas, the basal metabolic rate is lower. Next, we have emotions like stress, anxiety, fever, or burns, increases the basal metabolic rate. Ninth factor is drugs like nicotine or coffee also increases the basal metabolic rate. Physical activity like exercises or in case of athletes there is increase in the basal metabolic rate.